So what's the most shocking thing you've ever heard of happening in surgery? We're going to be going through a number of cases today, so don't go away. Watch this video till the end. The first case, quite interesting. This happened in the US some years ago, and it was a neurosurgery. So neurosurgery is brain surgery. Yeah, a neurosurgeon removed the right side of the brain of a patient when he was meant to remove the left.
Wow.
All right, so for those that don't know, the brain has two hemispheres. It has two sides. Yeah, and usually there's a dominant hemisphere. That means that hemisphere is more in control of everything we do, and most times people can live with actually one side of the brain and they can function. So this woman had a dysfunction of one of the hemispheres. She was having repeated strokes, and it was because of a problem with that hemisphere. And they found out that that was the non-dominant hemisphere. That means she could do without that hemisphere. So they decided to remove that side of the brain so that she would be able to probably live a more normal life.
Yeah, just prolong the quality of
Mistake.
life.
They removed the wrong side. What do you think would have happened? If you removed you've removed the good side and you've now left the patient with the bad side. So the woman just became useless.
Catastrophe.
There were lawsuits and all that, But of course, what has been done has been done.
Wow.
A similar thing happened in Kenya. This was from patients in ICU, head injury. They needed to operate to probably drain some blood from the brain. When the surgeon got to theater and opened the brain, he found out that there was no blood. The things they felt should be there were not.
Okay.
So he already knew there was a problem. Is there a problem with the imaging? Is there a problem with... It was at that point they checked the patient and found out that that was the wrong patient.
Wow. Woo.
Wrong patient. But how did that happen when they carried out the investigations? It's simply because the patient was unconscious. And how do you identify an unconscious patient?
Wow.
Tags.
Wow.
So the person who was placing the tags placed the wrong tag on
a conscious patient.
No, it was both of them both patients were in the ICU.
Both patients were in the ICU.
But had wrong tags.
Had wrong tags.
So one did not need surgery, one needed surgery, and then they ended up operating on the wrong patient.
So are we going to say this the division of labor in healthcare?
Yeah, so it just makes us realize that there can be errors. There can be errors. And it's probably not because those guys are not well trained or anything.
Of course.
As a matter of some of these things that happen in the US, these people are well trained. They have a lot of
checks and
balances, exactly. But there can still be mistakes. Let's get that right. So next time you see some of these errors in Nigeria, don't just come up and say, well, it's just Nigeria, it's just these Nigerian doctors. No, we are not trying to defend doctors here, but let's know errors are a part of the human endeavor, and there are ways we actually try to prevent. We'll discuss some of those ways.
Maybe with advent of AI, we were discussing it some days back that maybe AI after some time can remove human errors.
No, but AI will not remove human errors completely. You still have to interact and make sure the AI doesn't make those mistakes.
Exactly.
Yeah.
And things can even happen.
Yeah.
With AI,
the unexpected can happen.
Yes.
And is the AI ready for the unexpected?
Exactly. Human beings can act.
So human beings are actually very important. So we'll be discussing one or two things later on about how we prevent this. So wait, the next case, this one is orthopedic surgeons.
the bone cutters.
Yes, those are the bone surgeons. There was a diabetic patient who needed an amputation.
Okay, diabetic foot.
Yes, because the foot had a problem. I don't know if it was gangrenous, but there was a problem with the foot. So needed to take off that foot That's what is called an amputation. Guess what? The wrong foot was cut.
But how? Really how?
How? Okay.
Yeah. Okay.
Yeah, because you expect that with the kind of diabetic foot we see in Nigeria,
exactly.
it will be obvious.
It will be obvious now.
It's not like that. When patients present early and diagnosis is made early.
But wait. If there's a diabetic foot and there's early detection, why should it be amputation? Except it's something totally different.
So I don't know the details, but I'm sure this happened.
All right.
Right? So I don't know the exact indication, but the truth is that leg needed to be removed.
The whole point was that the leg needed to be removed, and they removed the wrong leg.
Remember that in places where you have prostheses readily available, removing the leg is not as much of a big deal as you have in Nigeria, where somebody will say no, even though that leg is bad, it's going to go to the grave complete. All right, so I'm saying, even aside indications of gangrene, there are other indications.
Of course, there are other indications.
Such that it may not have been an indication that was so obvious. Now, the other way that could have happened.
What if there was a necrotizing?
Yes, that's what I'm saying. It's most likely it wasn't that kind of infection that was very obvious.
Okay. All right. Just trying to wrap my head around.
Yes, that's a bit difficult. That's why we say shocking.
Yeah, very shocking
surgical story. So it's shocking. Now let me even shock you a bit more.
Yeah.
What ended up with the patient? They now had to go back and remove the other leg, which was the leg that should have been removed. So the patient ended up amputee. So they ended up removing both legs. All right. So of course they sued the hospital, and of course they got a lot of money. But again, errors happen. Number 3.
Is that number 3 or 4? Is that?
Yes. So the first one was 2 in 1.
Okay.
2 brain surgeries in one, and then the orthopedic surgery. Now this one is
indigenous to
this one.
Indigenous to us.
No, it's not indigenous to us. This one cannot happen with us. There are some that cannot happen. Many of these cannot happen with us. The last one I'm going to tell you about is the one that happens with us
commonly with us. Okay, all right.
But this one will not happen with us. A nurse mistakenly infused soup into the intravenous port of the patient.
Oh my goodness. Soup.
Yeah, so when you go to the hospital and they want to give you a drip, we are going to put something we call a cannula into your vein, so that we can pass the fluid, antibiotics and some other things into your bloodstream.
Yeah, it goes to the blood.
It goes directly into the blood. Remember, for those of us that are not medically inclined, food that goes into your mouth is different from food that goes into your bloodstream.
Yeah. So
it is when your intestine absorbs the nutrients that it goes into the bloodstream. It's not, you cannot take a bar now and put it into your vein. So in this situation, this patient was sick, depressed level. Of course, the patient had a depressed level of consciousness. Now that patient was being fed through what we call a gastrostomy tube.
Okay. Yeah.
So that tube goes straight into the stomach. And you are supposed to, you can hang specially prepared drips.
Okay. Yeah.
And then connect it to the tube. So the food just goes into the stomach, and then the body digests it normally.
Yeah.
But the patient was also on regular IV fluid. So this nurse did not check to confirm that she was connecting the food to the right.
I see. I get it now.
All right.
The consistency,
No, all right. So when we say soup, soup is just a way of us saying it was food.
Food, yeah.
It's not like it was soup in the kitchen.
They are specially prepared, of course.
Yes, so these preparations are special. So the soup is to catch their attention. It's not like soup. It's not like a goosey soup.
Okay, yeah. Okay, because we needed to clarify that.
Yes. So specially prepared enteral nutrition that was supposed to go into the stomach.
Enteral nutrition now became parenteral.
Exactly. What do you think would have happened?
Embolism.
Yes, because that food just goes
to the heart.
Yes, and then
Yes, to the heart.
a lot
to
of
the lungs.
to the lungs, and of course, the patient died. All right. So again, errors. Now the last.
Now, but before we leave that,
Okay.
that's it. People can misadminister medications.
Yeah.
You go and you want to give a clear injection, and I've seen, okay, there have been instances you want to flush. You just want to use normal saline to flush, or what we call aqua.
Yeah.
To flush an IV access, and then mistakenly people inject KCl. That's the worst case scenario. KCl.
Yeah.
KCl is potassium, and you must not
Push it into the blood.
You must not be pushed into the blood, and then you push cardiac arrest straight.
Yeah.
So that can happen too, if care is not taken. Yeah, that's
so the last one.
Common.
There are many.
There are many
but
things
I've just selected a few. Now this last one is common in Nigeria, but is not limited to Nigeria.
Yeah.
Because as a matter of fact, this example did not happen in Nigeria.
The particular
This
one
particular one I want to talk about. Well, I'm going to talk about a few that happened in Nigeria. Now, a patient went for prostate surgery. So a man had an enlarged prostate. They needed to remove the prostate. Surgery went well. But after surgery, the man was unwell. He kept, coming in and out of hospital. They were treating him for infection. Guess what? A few weeks after surgery, they saw a piece of gauze coming out of his wound.
Yeah.
A piece of gauze. Gauze is what we use for dressing. They saw it come out of the wound. So they had to now evaluate him. Guess what? We say shocking. We are not even saying that something is not happening. Like we say, you put soap into those are shocking. We are not saying there's not some other mistakes. For example, you want to give one antibiotic, you give a different antibiotic.
Yeah.
That's a mistake, but that's not shocking, right? Really. Or maybe you want to give one brand, you give another brand. Maybe the drug doesn't work.
Shocking.
Causing
catastrophic events.
Guess what? They found out that they left 16 items in that patient. 16 items. They found scissors there. They found plaster there.
The surgeon and they must just have been.
They found face mask there.
How?
They found whatever you can think of.
How? It's unbelievable. So shocking. That's shocking. So that even happened. It looked as if it was trash. It looked as if these items were meant to be trashed, and then they trashed it into the patient's belly. Of course, lawsuits, a lot of compensation, and all that. No.
So now, why I said this is common in Nigeria is that stories of people forgetting.
But that particular story didn't happen in Nigeria.
That one did not happen in Nigeria.
But we hear stories of people forgetting stuff in Nigeria.
So lots of pads, for example, that people use during surgeries, they forget in them. In fact, I've seen
abdominal packs.
I've seen more than 10 that I've had to reoperate on and remove those parts, and they present in different ways. So guys,
someone does the surgery and still not getting better, infection, or they can come in different forms.
What's the advice we have? One, as patients, always be engaged. They always ask questions. All right, so they want to give you an injection. There's nothing wrong in you asking, oh, please, what injection is that?
Yeah.
Do you mind if I look at the sleep? A number of patients, some of my patients do it. We want to give them chemotherapy. Yeah, doctor, do you mind that I look at the sleep? Yeah. Yes, I remove the sleep and give it to them. Of course, they won't understand most of what is there, but at least
they know what.
Maybe when they are checking, they will see that, but doctor, there's something about this drug, and they say, oh, really? And because anybody can make mistakes, it's not a question of what you want to see mistakes in me. You want to look for mistakes in me. No. Right, so
and
that's
please
one.
say it nicely. It's not like,
Yes,
you
say it
know,
nicely.
don't say it in such a way that to make the person that wants to administer the medication feel incompetent.
Yeah.
And to the healthcare professional that is going to administer that, don't take it as someone trying to think that you don't know what you're doing, or
someone
you
trying to
don't
ridicule you.
you.
Yeah.
You know, you are going to put something in someone's body. It's that person's body. They should know.
Yeah. Many times we ask patients, what drugs are you on? You say, I don't know.
I don't know.
You say, what test did you do? You say, I don't know.
I don't know. What's your okay? They are referred from a place. What's the diagnosis? I don't know. So what surgery have you done before? I don't know.
That information is very, very important. So there are if you think about where you work, there are always mistakes. You are doing your bank statement, there's mistake.
Yeah.
You are doing your accounts at the bank, there are mistakes. You are preaching a sermon in church, you are singing, there are mistakes.
There are errors.
A driver, somebody is driving, there are mistakes. Somebody is a pilot, makes a mistake. So we are, as human beings, we all make mistakes.
Just that when we deal with humans, we need to be more careful. We have to be more careful.
Yeah, we have
very careful.
One thing that is there that prevents such things from happening, especially in fact, virtually all the cases I've talked about, except the one about soup, all those ones that happen in theater, there's what is called a safety checklist.
Yeah.
That safety checklist is going to go through all those things I talked about. As the identity of the patient being confirmed, at that point, if the patient is conscious, you will ask the patient, what's your name?
Yeah. And
confirm that that's the file of the person you are holding. If the patient is unconscious, you must go back to check the name tag. Now, you are going to ask, as the site, that's the word of the surgery.
Let me come in. I remember just this week I was teaching with myself and my residents were talking about OSCE stations, and they gave an example of an OSCE station that they would just put it there and say perform, like the patient is already draped, perform an orchidectomy, removal of the testes. And I was telling them they just went to the procedure. I said, well, I don't know whether it's in the checklist of the exam, but if I were the one going through that motion of OSCE, what I would do first is to reconfirm that is the side that has a problem.
Yeah.
When there are paired organs like that, it's the side that has a problem that I want to operate on before I proceed in the operation.
Yes, so very important.
It might even be in their marking scheme, but I feel that should be the first thing.
It has to be there. It has to be there. So the checklist does that. The site of the surgery is confirmed. Different things. So it's a long list, and it takes care of all these details.
Yeah.
When you are operating, you must count the instruments, you must count the subs you are starting with.
Yeah.
And when you finish, you must count and make sure they are complete. That's the only way you can know you've not left anything in the patient's abdomen. So there are things that are really done.
You know,
and
those things
we are talking about AI. AI is going to help in some of those counting, but the humans must still be there to take responsibility.
Yeah. So for places like the labs, you know, you are performing a procedure in the lab, or there are standard operating procedures that probably have been put on the walls and all that, such that when you are performing a procedure, let's say a medical laboratory scientist now is working, and you might just need to check the standard operating procedure again to see whether you are doing. So it's not about you not having those things in your brain. But sometimes checking again just makes makes you remove those human errors.
All right. So once again, you're welcome to Dr. Dami Medic TV. Hope you've learned
one or two things.
Hope it's been interesting.
Yeah. If you want us to discuss anything, just the comment section away.
Yeah.
All right. Make sure you click like, share, subscribe, and click on the notification button so that you'll be alerted when we drop new videos. All right.